And welcome back to Talk of Alabama. Every woman's health is unique. That's why Brookwood Baptist Health feels it's important to provide individual care and services for women at every stage of her life. And they're adding some brand new amenities to labor and delivery. Right now I have Dr. Ashley Tamucci here to share all of the details. Welcome to you, doctor.
Thank you.
Glad you're here. Okay, so let's talk about these new features and amenities. What's going on there, Brookwood?
Well, we're launching a new program starting in September, and basically just adjusting to women's needs and desires as they have their babies.
Right.
One of the things that we found that's really inconvenient for women when they're having their babies and they're stuck in the hospital is that their support person, their spouse, their mother who's staying with them oftentimes has to leave the room to get their meals.
Right.
So we're going to incorporate meals for the support person. So you can order it just like you would a patient. They'll be delivered to the room just like the patient is, and that way you don't have to spend time away from your new baby and your new mother.
Okay, I love that.
We're also looking at some just comfort amenities, new linens and things like that, that we're excited about.
Okay, now there's something really cool that you guys are adding, and that is a nurse navigator. What will that person do?
So a nurse navigator is a new concept in medicine in general. We've used them in the hospital as far as helping women navigate their cancer care, and now we're going to apply it to birthing.
Okay.
And the idea is that we will give patients a resource to meet with a nurse navigator one-on-one and just sort of help guide them through the delivery process. It includes everything from signing up for prenatal education classes to helping them with their insurance, figuring out what type of delivery they want. We'll help them register for the hospital, give them personalized tours.
Okay,
They'll even have a chance to meet with nurses one-on-one and talk a little bit about their birth plan, whether they want to go unmedicated or not, and what type of delivery they want. And the nurse navigator is going to help us plan all of that through the physician's offices as well as through the nurses in labor and delivery.
Okay, that's fantastic. I can only imagine that that will help put so many moms to be at peace, because they kind of know what to expect.
Absolutely. It's scary, and there's a lot of anxiety around having a new baby, and anything that we can help to alleviate that is beneficial for the patient.
Okay, now you mentioned some classes that you will have available for moms and then also for other members of the family, I hear.
That's right. So we have lots of opportunities for prenatal classes, everything from just the traditional childbirth class to an unmedicated class. We also have classes for the daddies.
Nice.
We have classes for grandparents. We have breastfeeding classes, and also sibling tours. So if you wanted to bring big brother or big sister to be into the hospital, to have them kind of understand mommy's going to come to the hospital, she's going to have a baby, this is where she's going to be staying, maybe it wouldn't be so scary for them.
Oh, I love that idea. Man, so many new things that you guys have going on that's really going to add to that overall experience for your coming through there.
Absolutely, and the less they have to worry about as far as planning and organizing, the better for them. They can concentrate on just having their baby.
I know, and that special time, right, that you'll never get back. You'll never get those moments back. Are there any other new features that people at home should know about that you guys are incorporating? I think we hit them all, right?
I think we did, really.
And there was a lot, so high five to us for getting through all of them. How can people learn more about you guys and stay connected?
So we will be providing information, especially in the doctor's offices, especially on the first prenatal visit, where we'll provide a folder with all the information and the things that we have available. Also, iChooseB.com is our website, so a lot of that's going to be posted on there for patients maybe who are already pregnant when the launch comes into effect in September.
Right.
So we're using a Labor Day launch.
Oh, I love it.
The pun, to tell people about our new services.
Very clever. Okay, so good luck to you guys.
Thank you so much.
We appreciate you coming on, doctor, and sharing more information about what you guys have going on there.
My pleasure.